So tell us a little bit more about gum disease and why is it important to maintain regular periodontal care?
So gum disease, called periodontitis, is a chronic low-grade infection of the gums and the underlying bone. And it's caused by bacteria, but sometimes, and in certain forms of periodontal disease, there is a genetic component as well. But the primary cause is bacteria. And the bacteria lives in the plaque, it lives in the tartar or the calculus that's present, and it causes an inflammatory response to which your body's response is destruction of its own bone. And as the jawbone gets eroded away from around the teeth eventually have less support and fall out. Smoking or certain systemic conditions are contributing factors as well. Certainly, if you smoke, your chances of getting ongoing progressive periodontal disease are higher. But bacteria are key primary etiology for the development of the disease. Treating it obviously is important to retain your dentition, but also to prevent some systemic conditions to which periodontal disease is correlated. So, for example, periodontal disease, because it is an inflammation per se, it is related to preterm low birth weight babies. It's related to cardiovascular disease, and it's related to diabetes. So when you have periodontal disease, it doesn't cause diabetes, but it makes your diabetes more difficult to control. Mm-hmm. When you have diabetes, it makes you more susceptible to periodontal disease. So it is sort of this catch-22. So certainly controlling the periodontal disease and severing that link between periodontal disease, cardiovascular disease, or diabetes, et cetera, is very important.
Have you found that you've had to work together with physicians in this case?
I have, absolutely. So that is a key role or key part in my practice as well. Sometimes, I've had to work very closely with endocrinologists to get the diabetes and the periodontal disease under control. At other times, you have to work together with, the individual's family physician because they're taking certain medications, for example, to manage their high blood pressure. That's causing overgrowth of the gum tissue to the point where the gums can actually cover almost 75% or more of the actual tooth structure. And that contributes to the progression of periodontal disease by trapping more food, plaque, bacteria beneath the gum line. If certain individuals are taking blood thinners and we have to treat their periodontal disease, we do need to get involved with their hematologist to make sure that their coagulation factors are in check so that we can perform our role to control the disease process.